Good morning, everyone, and thank you for joining us. So if you're not familiar with Systems for Action, we study ways to align and connect medical, social, and public health systems with the goal of improving population health and advancing health equity. So this Research in Progress webinar series is where we have our grantees present on the progress of their research projects. And today we're going to be hearing from our team at WashU on their project investigating systems alignment of multi-sector agencies to address child maltreatment in St. Louis. And this is their second time presenting, so we're really excited to hear about their progress. So I will be giving the welcome, and then we'll hear from the team. So we'll hear from Melissa Johnson-Reed, Trish Cole, and then we'll hear a commentary from Helen Robinson. And once they're finished with their presentation, we'll have 10 to 15 minutes saved for questions and answers. So if you have any questions along the way, please do use the Q&A feature at the bottom of the screen. And just to give a little introduction to our presenters, so we have Melissa Johnson-Reed, whose work focuses on understanding how to improve the behavioral, educational, and health outcomes associated with child exposure to trauma, particularly abuse and neglect. And Dr. Johnson-Reed is the chair of the Violence and Injury Prevention Concentration in the Master of Social Work program at the Brown School. And we have Patricia Cole, who is focused on strengthening, implementing, and sustaining evidence-based interventions that improve the quality of care for vulnerable families. And we'll hear a quick commentary after Drs. Johnson-Reed and Dr. Cole present from Helen Robinson, who studies participatory empowerment processes embedded within intervention research that improve health and reduce health disparities. So with that, I'm going to give it to the team so they can update us on their exciting research.
Great. All right, thank you so much. I am just checking. I don't think I have slide control quite yet because I don't see the little arrows, but Trish and I are excited to be here with you today. We just have a quick slide on funding acknowledgements. So our project is both funded by ACF, which is the implementation of the collaborative project, and of course by the Robert Wood Johnson Foundation, which allows us to overlay a more rigorous evaluation on top of the PACT St. Louis. And if somebody could, great. I won't read this, but we have a wonderful multidisciplinary team on our project that's working with us on analysis, business, health, systems dynamics, and a variety of other factors so that we can better understand both the broader context as well as the child level outcomes and family level outcomes. Okay. So the overarching study aims, we really have three aims: to examine the alignment of services and funding through both content analysis, group model building, some network analysis, and some qualitative work. That's really going to be our focus today. So last year when we presented, we just sort of presented what our project was because it hadn't really started. This year we're actually going to talk a little bit about aim one. Our second aim is looking at community level change. We're waiting for our state data to do this, so hopefully next time we all meet together we'll be talking about that. And then our final individual and family level outcome will be waiting until year 3 implementation. So I'm going to briefly first touch on the social network analysis, and then I'm going to turn it over to Dr. Cole to finish out the rest of the presentation. So we did a survey of the providers of the organizations in the network. There's 62 organizations. About 40% of those were actually members of the collaborative itself, and then the other organizations are organizations that they collaborate with in order to help facilitate services for families. We asked them to reflect on their pre-COVID and during COVID interactions. And we did find that the network contact did decrease, at least based on their self-report, by about 10%. Organizations collaborated with a mean of about 8.9 other organizations. This might be a little hard to see, but this is the pre-COVID contact network. So for those of you who are familiar with network analysis, the circles are reflecting, the orange circles reflect members of the actual PACT collaborative. The green circles reflect other agencies and organizations that responded, that they collaborate with. The size of the node has to do with the frequency of those interactions, and the ones that are more closely centered in the middle are interacting with each other more. And as you move out from there, you notice that there are fewer connections. And so this is a pre-COVID, and here is the post-COVID figure. And what we, it flipped back on me here. Let's try that again. Okay, the in COVID or post-COVID start. And what we notice is that there is a decrease in the number of nodes overall. And then in particular, what we noticed is that our housing and our healthcare organizations were those that moved out of the central network into the less frequent interactions during COVID. And just some thoughts about this. Obviously, during COVID, there were some restrictions on evictions, and so there were probably a little less urgent housing and legal requests, but also our healthcare organizations were really beset, like they are across the country, with the crisis of COVID. And so although that makes sense, it was a little concerning given the need for healthcare of our families during that time. And now I'm going to turn it over to Trish, who will continue on. You're muted.
That is the story of my life these days. Okay, so the S4A project really aims to help us better understand then how this community collaboration works or doesn't work to better prevent child maltreatment. And as part of this, we really do believe that it's essential that the voices of parents with lived experiences are uplifted and elevated and really listened to in this process, really heard. So in PACT, the community partner who is the backbone for PACT-STL, that is a priority, and within the evaluation, we're also seeking then to carry out an evaluation that centers parents' voices and that uses a racial equity lens. And so as part of this process, one of the things that we've done is hold focus groups with 3 of which were with caregivers, all of whom were African American, and then one who with the agency staff who are also caregivers, and 2 of whom had they were hired for positions because they actually had lived experience within child welfare. So there were 26 participants, and these were to hear about their experiences of how agencies in the St. Louis region work together to meet their needs, and the trust that families have or don't have in these agencies and the systems that are intended to provide care. Okay. Go ahead and advance it. Okay. Oh, can you go back one? Oh, nope, that's forward. No, you're forwarding it instead of going back.
I'm working on it.
Okay. Okay, here we are. So our analyses from these focus groups, there have been several themes that have emerged. Some center around really characteristics of the organization, around culturally responsive services, resource availability, and in another that we have characterized really around the organizational culture of caring or not caring. There are others that, another one that has emerged around individual providers and their qualities, their skills, their competence, their professionalism, as well as their relational and engagement and how they interact with parents. Anti-Blackness has emerged as a theme, as well as experiences of discrimination and violence due to race, but also due to family structure, father involvement or lack of father involvement in some cases, as well as then navigating the system and their perceptions of collaboration. So I'm gonna, now you can go forward. Okay, and I am going to not spend a lot of time reading these, but just to highlight some points here. The responsiveness came up multiple times in feeling unheard. They wanted places to be genuine. They wanted places that it was clear that the worker was passionate about their job and really wanted to help. It wasn't about just they're doing their jobs and didn't really care. Okay, next one. In that non-responsiveness was highlighted again. It was throughout the focus groups. You tend to trust organizations more when they follow up with you. This idea that they reach out, they talked about feeling like we're begging, we're having to plead for services that they talked about. They were built to support us and provide resources to us, but it doesn't seem like they want to. And so that emerged. Okay. There were across all 4 focus groups examples of when Black parents felt institutional and systemic racism, as well as racism at the individual provider level. And this, I have to say, was really pervasive. These are only 2. We have many, many quotes of parents sharing their experiences. I will also say that we have examples where they felt validated, where they felt supported. And so I'm highlighting here more of the areas where we have room for growth, because this is what we're feeding back to our collaborative around, okay, how do we address these gaps? How do we improve the experiences of families that are in fact seeking services from us or from them, from the organizations. And they talked about in terms of how organizations work together, that they didn't feel that the organizations were connected on their behalf. Not shown here, but we have some quotes of getting different information from different organizations. And so there was this sense of they don't really know much about what the other one's doing. Okay. You can go on to the next one. Another process that we used in order to hear, sort of to get feedback from parents, was community cafes. And so very early in the PACT-STL process, that was funded prior to this grant. There were a series of 4 community cafes, and that served about 100 people. The community members, it was an opportunity for their voices to be heard. They felt heard. They offered up the challenges that they have experienced. They also put forth interesting solutions to those challenges, which is really exciting. And so what has come forth from that is these working groups that are comprised of both providers and parents. That how did they work together in order to find solutions, in order to strengthen and enhance this collaborative network that's seeking to strengthen families and prevent child maltreatment. So then the next step in these working groups, that this has been a different experience. So this is introducing some challenges. So you know, when we know from the focus groups that parents talked about not really feeling heard. So when we brought parents and providers together, parents really wanted this to be an opportunity to get answers around their own personal experiences. And community members or providers were really, for multiple reasons, were off guard. They felt a little unprepared. And then there are certainly things around privacy and confidentiality that in a group setting, they simply can't talk about individual experiences of families. It needed to be a conversation that was more general about the system and the processes within the system. So there were some glitches. However, they did come up together with the importance of really better engaging schools in this effort, and that schools really need to be a more connected part of the network of organizations that are working to prevent child maltreatment. And so we are processing then, or they are processing new ways to move forward and to work together. Okay, group model building. So we had, let me just give a really quick overview of what group model building is. It's a method that really uses a systems perspective. If you think about an iceberg, you only see a small piece of that above the water. However, below the surface, when we're thinking about a system, you're thinking about there's the structure of the system, there's patterns of behaviors, there's the mindset, beliefs, and goals of individual organizations within the system, as well as their individual providers. And those may be shared among members of the system, or they actually may be conflicting. And so those can serve as either facilitators or barriers to the system really working together effectively. And it's also a process then. It allows us to examine factors that give rise to the problem. It explores how those factors then can be interconnected and provides really a structural view to identify interventions and potential leverage points. So we actually had, there was 2 official group model building workshops, 25 participants in the first one and 27 participants in the second one. These were providers across child welfare, healthcare, housing, legal and advocacy, research, family support, home visitation. And in the first workshop, it was really focused on framing strategic collaboration as a systems dynamic problem, and then identifying those barriers and facilitators. And so they were broken into small groups, and we've learned a lot in Zoom, and now know how to do sticky notes and all these. So what we would do in an in-person is have sticky notes, you know, have whiteboards with sticky notes, but we were able to bring that into the virtual environment. And so they worked together and wrote on in their small groups around what are then some of those barriers and facilitators. And so they wrote on to collaboration, and they used their sticky notes that helped guide the process. Okay. And so then our really awesome team, went to work on building this structure and building this model. And one of the things that came out is really this idea, and it ended up sort of getting labeled the tragedy of commons. Let me just say that. And it's about individual providers that are seeking funding to provide more resources, services, and to remain competitive. So there's only a small pot of money. And in order to stay in the game, they're competing for those that same money, and some are building. One person even called it sort of empire building that's happening, which is a disincentive to collaboration. Because they have their individual incentives to protect their piece of the pie. There is pressure to deliver services, which de-incentivizes investment in collaboration. And then without collaboration, though, organizations become more siloed, which overall hurts the system performance, hurts parents' experiences within the system. Okay. Sort of the next structure that came out that when we presented back to the larger group, this really resonated. It's called the capability trap. And in that, organizations are always having to face trade-off decisions about how to spend their time and money, provide services, invest in collaboration, and they get caught in traps where they're working harder and harder. But things like, data, learning, collaboration capabilities begin to erode. And so they're in this cycle of basically working harder and harder, but not efficiently. They're not necessarily working, taking advantage of all the efficiencies that could be in place. And so fixing this capability trap may require facing worse before better decisions, which is hard for organizations. Next one, where am I on time? Okay, and so coming from that, some key points, then our team worked to sort of bring those together. It is sort of a working document or working structure. As we get more and more data, it will evolve. But so this is sort of how do we bring those two, the tragedy of the commons and the capability traps together, to then inspire us in creative thinking of how do we address the structural challenges that promote collaboration. Okay. So in session 2, we really then focused on what are some potential intervention points to enhance collaboration. And transparency and accountability to build understanding and trust, specifically in terms of funding, reporting, and research sharing. So when we talked with parents, parents struggled with trusting organizations. Within our own process, the network of organizations that are providing services, they talked about the need to build more trust, and in that because of the competition, because of all these other factors that are in place, that some of them have been working together for a while, and there's still issues around trust. It was brought up from the providers as well, which corresponds to the parents, is we have to really look at the role of institutional racism and the uncertain political environment in St. Louis City. Now, I will say that this wasn't on the initial model, but when we presented it back and, okay, what's missing? This was raised as, oh, this is a huge thing that's missing that we've got to incorporate. This idea of wrong, oh, sorry, Melissa, can you go back? Yeah, wrong pocket. Nope, not to that one. You were on the right one. This one, wrong pocket problem in collaboration, where there is a difference between agencies who invest in collaboration and those who benefit. So who has the skin in the game is also really important. more and more grants, most grants at this point want to have some emphasize the importance of collaboration. They often don't really, they're measuring times met, who's at the table, and not necessarily the impact of the collaboration is what is participants actually talked about. And a piece of this also then is it limits then their talking about the vision for the collaboration is typically very short term versus what is the long-term focus of this collaboration? What is, 5-10 years instead of this quarter, this year, and then the grant goes away and we have to restructure as it's sort of looking slightly different to meet the needs of this next grant. Okay. We did, so I want to be cognizant of time. We did in the process in that second meeting, though, give them an opportunity. So here were the barriers the barriers that were identified in the first workshop. What resonates the most? And one of the things that we found on this, what's called a heat map, as you can tell by the colors, and the size, that there was a lot of overlap in what participants viewed as these are really the most challenging barriers: organizational resources, the willingness to collaborate, the need to grow the pot, increase the funding and funding opportunities, how the coordination required to sustain collaboration, and then that silo mentality. Okay, next one. Then, however, though, when we looked at, okay, what should we as a group, or what should they as a group really focus on to promote collaboration within this network? As you can see from this heat map, there wasn't a lot of overlap. So everybody was in some different places. In meetings following, the idea of working smarter and really strengthening impact has been highlighted as something that there seems to be some common interest in moving forward. Okay. The priorities then for system improvement are around funding resources. How do we better allocate the funding? Really they're wishing for a less uncertain funding environment, wanting accountability. The ownership and participation, who's at the table, who's driving it, who's driving the collaboration, certainly addressing the structural and institutional racism, and then the competition. And there are system challenges around the competition and how it's currently set up, that makes this one a tough one, but it is one that we really do need to tackle. Okay. So emerging themes. The community is very focused on perceptions of system responsiveness, of respect, accountability when mistakes are made by agencies, better definitions, clarity around what organizations provide, a desire for more prevention resources. Agency collaborators are very focused on funding fairness and accountability across the organizations. And there are issues related to structural racism within the community. Agency collaborators also discussed creating value and collaboration for the agency and building trust. So I will say one of the things here is that in the very first meeting, very first workshop, a notion that came up is, we talk about collaboration, but we're really just coordinating. As in follow-up meetings, the second workshop and then the 2 meetings after that, there's now this sense of, for a lot of us, all we're really doing is referring back and forth. So it's not that we have to get from coordination to collaboration. It's really that we have to get from referral to collaboration, to have that more meaningful, an efficient system that's working on behalf of families. Okay. So I have, yeah, go ahead.
So if Helen isn't able to join us, Trish and I are just going to offer some reflections. And so one of the things that we've learned so far is how important it is to have triangulation between the qualitative and the quantitative. So the network analysis provides us one picture of collaborators.
I'm sorry to interrupt. Echoing just quite a bit.
Oh, I'll mute.
There we go.
Is that better?
Yes.
Okay. So one message from the network analysis are, people's perceptions and nominations of other collaborators. And so that tells you one picture. But then when you talk to community and agencies, you get that qualitative, but what Trish just mentioned, we're really just kind of referring to each other. We don't really necessarily know each other very well. And so it was really fascinating to hear the parents talking about wanting that passion, wanting to know that the person they were working with really cared about them, that they were passionate about their job. And at the same time, when we're talking about organizations, we're talking about staff that are talking about wanting more flattening, wanting to be heard, wanting to be respected, wanting to have their own skin in the game in some respects. So there was really sort of this interesting parallel around needing that passion, that mission focus, wanting to know that their other agencies were as meaningfully committed to families and the community as they were. And then just the second thing I'll say, and I'll turn it over to Trish, is that when we were talking as a group, one of the things we were reflecting on, in addition to the COVID context, is that there's been some fairly radical changes over, say, the span of the last 10 to 15 years. So for example, our state child welfare has privatized, which moved things from mostly public child welfare out into the agencies, but then the state also overlaid performance-based contracting on top of that. So some of what you're hearing, just to give some context about that competitiveness and empire building, is that we did see many of our smaller agencies begin to form umbrella agencies to then compete for these contracts for funding, at the same time as some of the long-term CEOs who had often built some of these agencies from the grassroots up had retired. So it's just sort of an interesting contextual piece that doesn't really come out when you're doing real time, but also when you back up and think about what has happened in the community and in the state over the last 15 years that may have some impact on what we're seeing now. Trish, I'll let you. You're mute again.
Unmute. Okay. So in the piece that I'll talk some about is really that importance of centering parent voices that Helen has really helped us put at the forefront of this work. And she'll be the first, or I'll be the first to tell you that she will say, we still have some work to go. And she reminds us of that. And I really, really appreciate that. But in order to really do this work, we can't do it. We can't shape a system that is whose purpose is really to support families, to engage families, to work with families when there's been maltreatment, without actually listening and hearing and incorporating and having the parents with lived experience at the table in these discussions, in the idea of the need to uplift the need to trust and value their lived experience is so critical when addressing any issue and in inequality. And so we need to have parents be a part of identifying the issues, identifying the solutions, setting a policy agenda. And we can't do this work without bringing a racial equity lens to it. That is also absolutely very critical. And one of the things that means, and that we're we're an evaluator, but we're also using what we're learning in the evaluation to help our agency partner use what we're learning. And so there is we're this evaluator, but sort of a participant observer as well in also, you know, helping them find ways to use the data. And so one of the things that we're grappling with is having conversations where people sit in the discomfort of hearing parents' experiences, of hearing their experiences of racism, their experiences of feeling unheard, and that services aren't responsive to their needs. And so we're grappling with that being uncomfortable. And so we have some work to do in that area, but I think it's really, really an important part of this work. In order for the system to transform in ways that better meet the needs of families, we can't do that without valuing and respecting their input. And I like when in this work, when we talk about also trusting what they say. A lot of times we find ourselves having conversations with, oh, well, that's just their perception. That's really not what happened. It is their lived experience. So how do we ensure that we're also valuing their lived experience, recognizing at the same time that these are families that have, for some reason, become involved with the child welfare system, which would suggest that there's a lot of complexities going on in the family. So how do you balance that? And so it's a challenge, but it is an important piece of this work that we are continuing to grapple with and to work on.
And I will say one of the things that we're interested in doing also is going back and perhaps doing a group model building session with the line staff. So we've been doing sort of the providers and the collaborators, and having heard the parents talk about the respect and need for that, and now the collaborators, we're sort of interested in this group in the middle as well to understand their perceptions.
Well, thank you both for providing an update on your research project and for stepping in and providing commentary since Helen was unable to join us today. And Melissa, I'm going to kind of jump on what you were saying there to ask the first question here in our Q&A section. Could you provide us a little bit of an update of where you're headed next in your research project?
So I just mentioned one thing that actually came out of our team meeting yesterday. What was to work on that. We're also, we've been collecting documentation from all of the meetings and the groups and that. And so that's one of the other next steps in the aims, is to go through and do sort of a qualitative text mining of that communication. We are in the process of looking well, we're in the process of waiting for, I should say, our state health and child welfare data to look at the zip codes pre, during, you know, and post change, because we really do want this full layer, sort of all sizes, by the time that this project is over. And then of course we wrap up when the families have been engaged long enough with some individual looks at child and family outcomes, where we'll actually be doing interviews with parents and that who are accessing services at some level with the collaborative.
Great, thank you. And this team will be presenting again sometime in 2022. So if you're interested in hearing how things are going, please join us again then. I'm going to move on to our next question, which is from Aaron Miller. And he asks, in our busy work lives, how would collaboration look?
So I think that is a great question at the heart of this project. And oftentimes what it seems to mean is we come together for meetings, that there's meetings. And we talk about what we're doing, each organization. And as I said, the more we've delved into this with our particular collaboration, is that the collaboration that we're evaluating is that they're seeing, as they better understand what true collaboration is, that they're really not there yet. And what our community partner and the executive leadership committee of the executive leadership committee, which is a subset of representatives from the full collaborative, what they're now in a process of doing is, okay, what does collaboration mean for our particular network? What are we want to get away from, okay, it's basically just referrals and coming to meetings. What do we want it to look like for us? Because I think it looks different for different groups, and is where I have landed in this work. Yeah.
And I think going back to the capability trap, some of them are reflecting on collaboration can't be one more task that we add. It has to be an underlying way of behaving. So there may be things that we have to shift and trade in order to make the space and the time to do that. And I think there's a lot of decision-making processes now with these organizations. What Tricia was talking about is like, what do we set aside? What do we do differently so that we can have the time and the focus to move in that direction?
Thank you. And you talked a little bit about competing priorities and collaboratives and how there are a lot of short-term goals. Has your collaborative been successful with creating a long-term goal?
That's a goal. It's one of our short-term goals.
That's a good goal.
And many, I have to say, many of the organizations that are participating, even some of the families, have been parts of other community collaboration models, all sort of with this long-term child well-being. This particular one's more focused on maltreatment and foster care placement prevention. And so that is, of course, the goal. Mm-hmm. But I think, as Trish mentioned, one of the challenges is that the funding tends to be short-term. So even when they can get new funding, the funding tends to be just a little bit different. And so everybody sort of realigns to absorb that and tries to figure out then how to keep going on a particular goal when the funding source might want something kind of different.
Right. I'm going to move on to our next question, which is from Drew McGee. In bringing parent voice into conversations and work groups, are parents being compensated? And if so, where is the funding for compensation coming from?
They absolutely are being compensated for their time. That was, as Melissa said, ACF has funded the implementation grant, and that is built into the implementation grant. It's also part of the sustainability conversation, that if we want to continue this work once the grant funding goes away, where does that come from? Because that would be we don't want parent voice to go away at that point, but they need to be compensated. And so I will say that our community partner, Vision for Children at Risk, is really looking at sort of their strategic plan and their long-term funding sources around how do we sustain the convener role in, so that it's not from grant to grant. How can that be sustained? And also, how do we sustain that compensated parent involvement? Yeah.
And I will say that they have also hired 2 of the parents as family navigators. So there's both the sort of short-term compensation, like how do we reimburse your time for showing up at a meeting, but there's also sort of like, how do we integrate persons with lived experience into the actual programming that we're doing. So that's another way, albeit a small number, of looking at that.
We have another funding related question, so I'm going to skip down and ask this one. What are some of these funding sources, and is there any braiding or blending of funds?
So,
oh, go ahead, Melissa.
Yeah, no, I was going to say, we're looking at their budget information now. That's part of the document collection, so I can't totally answer that. Trish, do you have some? I mean, there are some sources of blending among some agencies that are a part of other umbrella organizations that are competing for performance-based contracts. That's not exactly the same as braiding throughout the whole collaborative. I don't know if Trish has other.
No, that is in process, part of the work. The PACT. The implementation funding is through the Administration for Children and Families. There's a community collaborative grant program that is specific around strengthening families and preventing foster care placement, and that's where the implementation funds have come from. But there's other sources of funding. Many of them are short-term, Children's Trust Fund, and so we're really at this point taking a look at that to inform the sort of, as we think about realigning, how do we realign funding to be more efficient? How do we both grow the pot of funding that's available as well as be more efficient with the funding that is available? That's an in process. So hopefully next year we'll have an update on that one.
Yeah. And I will say there's been some attempt to preserve learnings and programming from one collaborative to another. So the community cafes, for example, were started in another program and then were brought into this work to target a different area, but those are also still ongoing from another source. So there is some attempt to work through those sharing of resources, or at least knowledge base and training.
Yep.
Thank you. So Karen Vicari asks, as the project moves forward, how can national organizations like Parents Anonymous use this research and help spread your messages related to the need for and value of parental involvement across the country?
Great question. Go ahead, Melissa.
I think maybe this is a little too optimistic, but I think this is information coming from multiple sources. So it's not just our project that's focused on increasing voices. I've heard this from a lot of our home visiting agencies. And I think there's sort of a more general outreach to parents and figuring out how to integrate them more into services and planning. I think to some extent we'll know more as we go forward how included parents actually feel in the planning. Right now, we're sort of reporting on their initial thoughts, Trish, I don't, and we'll have more of a sense of what happened and how they felt about actually being at the table as things are designed, particularly as families first kinds of reforms roll out in our community.
You know, and I'll comment on the meeting yesterday. So the Melissa Center for Innovation in Child Maltreatment Research, Policy and Training had a 2-day sort of learning collaborative meeting, and what percolated for a large group, there was actually there was 15 to 20 of us in one of the breakout rooms talking specifically around this, around parents' role, how parental engagement, how do we value parents? How do we not look at parents as sort of the object of research, but seek to better understand their sort of the cumulative trauma, including the trauma that is associated with being involved with the child welfare system, and that impact that has. And then the second piece of that is also that I'm really excited about, that is, and it's important. How do, you know, we talked in this project, we actually talked to parents about how they viewed providers, but it's really important. How do providers actually view parents, particularly parents involved in the child welfare system, and that we have to grapple with that and have a better understanding and change our services, that there is a more positive view of parents. So I think that there is a lot of energy, and the point there is a lot of energy in the field. And this was researchers, this was practitioners having this conversation around, we have to do a better job of how we're incorporating parents into research and how we're incorporating parents' voices into programs and services. Yeah.
And I think it would be exceptionally valuable if experiences across systems of this were shared. So to the person's point, because I'm also, my other hat in school social work in the past, I know particularly with the pandemic, a lot of the school partners that I work with are trying to do the same thing. So, you know, you have parent-teacher associations, but that's not really parent involvement in the schools. So I think as the different systems are reckoning with this and thinking about that, the more maybe RWJ and that can help systems share this information across how parents' voices are being incorporated, be it healthcare or education or child welfare, that would be really, really helpful.
Thank you both. We have a question from Juana Valladares on the effectiveness, or how effective network organizations have been during this time of living in a pandemic.
So that is a great question. And I think that there were certainly learning curves that had to happen. There were services that were typically in person that moved to being delivered virtually. I think a lot of learning happened, and I think overall it went better than I certainly expected it to go. And so that was exciting. I lost my thought. I'm really sorry.
Well, I think, so we have a field agency advisory board with our center, and this is one of the main topics of discussion now is going back through all the lessons learned. Honestly, like they're actually starting to breathe and head above water and say, okay, what what did we do differently? That there are some things that happened during the pandemic that people are saying, maybe this is a keeper. You know, this particular approach seemed to work a little better for this subpopulation. And so ferreting out like not only what did the agencies do in response to the pandemic, but what things may we have learned because a crisis forced us to do something differently that may then actually be more beneficial for not maybe all parents and families, but a certain subsets of parents and families. And I think everybody's kind of trying to figure that out. It's still kind of anecdotal, and now everybody's trying to pull that data together and figure out, okay, how did we work differently and what things do we want to keep as positive learnings going forward so that we have a more individualized take on what families need.
All right, we got about 5 more minutes left, so I think we have time for maybe 2 more questions. So for this next question, with this realignment effort and drive for better collaboration, will there be any modifications or advancements made to data interoperability or eligibility and enrollment across agencies?
That is the goal. That is the hope. In these next 2 years, data sharing both came up from parents as well. In this time frame, it was really hard. We have so much data. It was really hard to pick and choose sort of, but data, that idea of data and data sharing came up both from parents and providers. So that it has been identified as certainly as a priority moving forward. Absolutely. Yeah. Okay.
All right. Next question is a comment and a question. Let me get to the question here. Have you thought about how to approach solving the wrong pocket issues? It seems like a large issue to tackle within a short amount of time within a 2 or 3 year period grant.
I absolutely don't disagree with that. I don't disagree with that. And I think that though a small step, that having conversations about it within the collaborative has been a first step, that it's been acknowledged, it's been recognized, and at least at the executive leadership level, there is interest in grappling with it. We'll see. So we still have 2 more years. So it's 3-year grant. We have 2 more years to do this work. So hope to move the needle a little. I really do. Maybe I'm overly optimistic.
I do think one of the outgrowths of the pandemic are that people are thinking a little differently. It did sort of jar some systems out of the usual mode of thinking. And so that oddly enough may help us move some of these other things along, assuming that effect doesn't die off.
Thank you both. And as Michael mentioned, we did just have a CFP close on this wrong pocket issue. And so we hope to have a few more grant research projects that will be presenting on their work on how they're going to try to find solutions to answering the wrong pocket problem by the end of this year. So definitely stay tuned for our announcements on that. Thank you for answering all those questions. We'll move on. I think we have maybe 1 or 2 announcements, and the first one will be that we will send out the recording and the slides from this presentation to everyone that registered for this webinar. So you'll receive those by tomorrow. And our next Research in Progress webinar will be a panel on the local public health governing boards, and that will be on July 7th at 12 p.m. Eastern time. So we hope that you can join us then. Is there another announcement? There is not. Well, thank you so much for joining us today, and thank you to the team for presenting on their research project. And we hope everyone has a great day.